6 hidden vitamins that can affect your mobility. What you need to know. Welcome to your health partner. Did you know that the vitamins you thought were beneficial to your health could actually be weakening your legs? How can we ensure that vitamin supplementation isn't the cause of our muscle loss and mobility issues? As we age, vitamin supplementation becomes an essential part of our daily nutrition. However, some vitamins, while important, can be harmful if taken in excess. Have you ever felt that your legs are weaker or had trouble moving, even though you're careful with your diet? In this video, we'll explore 6 vitamins that may be weakening your leg strength without you even knowing it. You'll learn how these vitamins affect your body and how you can protect your legs and maintain your mobility as you age. Stay tuned to learn more about these vitamins and how to protect your leg health. 1. Vitamin E. The muscle destroyer role and importance of vitamin E. Vitamin E is a powerful antioxidant that helps protect cells from damage caused by free radicals. It is not only important for heart health, but also helps protect the skin, eyes, and improve the immune system. However, when used incorrectly, especially through excessive supplementation, it can harm muscle health, directly affecting leg strength and mobility, particularly in older adults. Mechanism and side effect of vitamin E. Vitamin E is a fat-soluble vitamin, meaning that when you consume too much vitamin E, the body stores in fat tissues and the liver rather than excreting it like water-soluble vitamins. This leads to a gradual accumulation in the body over time, resulting in overdose. Medical studies have shown that excessive vitamin E supplementation can disrupt the nervous and muscular systems. Specifically, it can cause muscle weakness, fatigue, and balance issues, increasing the risk of falls. A study published in the American Journal of Clinical Nutrition found that high doses of vitamin E can impair balance and reduce muscle function, especially in older adults. Excess vitamin E can also thin the blood, making it harder for blood to clot after fall or injury. Scientific research. Studies have shown that overdosing on vitamin E can increase the risk of falls and serious injuries. Specifically, research from the American Journal of Clinical Nutrition found that vitamin E affects muscle function, leading to fatigue and weakness, especially in older adults. Furthermore, excess vitamin E can reduce blood clotting ability, making it harder to stop bleeding after injury, thus increasing the risk of serious harm in the event of a fall. Conclusion and solutions, based on medical research, to protect muscle health and mobility, rather than using vitamin E supplements, you should opt for natural food sources to provide vitamin E. Foods like sunflower seeds, almonds, avocados, spinach, and tomatoes provide vitamin E safely and effectively without causing unwanted side effects. Supplementing vitamin E from these food sources not only helps protect the body from free radicals, but also helps maintain flexibility and balance in movement. Therefore, to maintain muscle health and avoid the side effect of excessive vitamin E supplementation, prioritize natural foods. This will help you maintain mobility and independence throughout your life, especially as you age. 2. Vitamin A. The attack on bones and muscles role and importance of vitamin A. Vitamin A is an essential vitamin, especially important for maintaining eye health, immune function, and skin health. Vitamin A helps the body fight infections and also supports cell growth. However, while vitamin A is vital for health, excessive supplementation, especially in the form of retinol found in animal foods, can cause serious issues with bones and muscles. Mechanism and side effect of vitamin A. When the body absorbs excess vitamin A, particularly from supplements or retinol-rich food sources. It can trigger bone resorption, making bones fragile and prone to fractures. This is especially dangerous for older adults, as a combination of weak bones and weak muscles can significantly reduce mobility and independence. A study from Harvard Medical School found that consuming too much vitamin A can accelerate bone loss, causing osteoporosis, making bones brittle and easy to break. Furthermore, excess vitamin A also affects muscle function, leading to muscle weakness and fatigue, which reduces the ability to move. Studies show that excess vitamin A can interfere with balance and increase the risk of falls. Scientific research from Harvard University shows that excessive vitamin A intake can reduce muscle strength and cause osteoporosis, increasing the risk of bone fractures, especially in older adults. Additionally, vitamin A can cause muscle fatigue, reducing the body's ability to move, which severely impacts quality of life. Conclusion and solutions. To avoid the negative effect of excessive vitamin A, instead of using vitamin A supplements, you should choose foods rich in beta-carotene, which the body converts into vitamin A as needed. Beta-carotene is found in foods like carrots, sweet potatoes, pumpkins, and leafy greens such as kale. These foods provide vitamin A safely, without posing a risk to bones and muscles. Supplementing vitamin A from natural food sources not only helps protect eye health, but also helps maintain muscle and bone strength. By replacing vitamin A supplements with natural foods, you protect your body from the harmful effects of excess vitamin A while maintaining flexible mobility. Remember, vitamin supplementation must be done properly and in moderation to maintain a healthy and active body. 3. Vitamin B6. The nerve damage culprit importance of vitamin B6. Vitamin B6 is a crucial vitamin for the nervous system, supporting brain function, aiding protein metabolism, and producing hemoglobin, which transports oxygen in the blood. Vitamin B6 also plays an important role in maintaining the balance of brain chemicals, directly affecting mood and mental health. However, while vitamin B6 is essential for the body, excessive supplementation can cause serious issues for the nervous system, particularly nerve damage to peripheral nerves, leading to muscle weakness and reduced mobility, especially in the legs. Mechanism and side effects of vitamin B6. Vitamin B6 is a water-soluble vitamin, meaning the body excretes excess amounts through urine. However, if the intake of vitamin B6 is too high, the body can still accumulate it over time, especially when supplements are used. This can lead to peripheral neuropathy, a condition where nerve damage causes tingling, numbness, and muscle weakness, particularly in the legs. Scientific studies show that long-term, high-dose vitamin B6 supplementation can lead to peripheral neuropathy, which affects nerve control and causes symptoms like numbness, weakness, and difficulty moving. This significantly impacts mobility and overall quality of life, especially for older adults. Scientific research from the National Institutes of Health reveals that high-dose vitamin B6 supplementation over time can lead to peripheral neuropathy, which causes significant issues with controlling movement. Symptoms commonly include numbness, weakness, and difficulty walking or climbing stairs. Conclusion and solutions. To avoid the harmful effect of excess vitamin B6 supplementation, get vitamin B6 from natural food sources. Foods like bananas, potatoes, chicken, green beans, and legumes provide adequate amounts of vitamin B6 to support nerve health without causing nerve damage. Replacing vitamin B6 supplements with natural food sources ensures you get the vitamin you need without risking permanent nerve damage. 4. Vitamin D. The nightmare for bones and muscles role and importance of vitamin D. Vitamin D is crucial for calcium absorption, helping maintain bone and muscle health. It also regulates immune function, supports cardiovascular health, and improves overall well-being. Vitamin D helps maintain the strength and flexibility of muscles, including leg muscles, ensuring mobility as we age. However, excessive supplementation can lead to serious issues with bones and muscles. Mechanism and side effects of vitamin D. Vitamin D is often called the sunshine vitamin because the body synthesizes it when exposed to sunlight. However, excessive supplementation can cause a buildup of calcium in the blood, leading to calcium deposits in soft tissues like the kidneys, heart, and blood vessels. This can weaken bones and muscles, increasing the risk of fractures, particularly in older adults. A study from Mayo Clinic showed that excessive vitamin D supplementation could lead to excess calcium in the blood, causing calcium deposits in soft tissues, weakening bones and muscles. This condition makes it harder to move and increases the risk of falls. Scientific research. Scientific studies show that too much vitamin D leads to calcium buildup in soft tissues, weakening bones and muscles. Research from the New England Journal of Medicine reveals that excessive vitamin D can impair muscle function, causing muscle weakness and difficulty maintaining balance, especially in older adults. Conclusion and solutions. To maintain safe and effective vitamin D levels, focus on natural food sources and sunlight exposure rather than supplements. Foods like salmon, eggs, fortified milk, and other vitamin D-rich foods are safe sources of vitamin D. Additionally, spending 10 to 15 minutes in sunlight each day helps the body produce sufficient vitamin D without the risk of overdose. 5. Vitamin K. The blood clotting issue role and importance of vitamin K. Vitamin K is essential for blood clotting and maintaining bone health. It helps the body produce proteins necessary for blood coagulation, preventing excessive bleeding when injured. Vitamin K also helps keep bones strong and prevents osteoporosis. However, excessive vitamin K supplementation can be problematic, particularly for individuals on blood-thinning medications. Mechanism and side effect of vitamin K. There are two main forms of vitamin K, vitamin K1 and vitamin K2. Vitamin K1 is found in green leafy vegetables, while vitamin K2 is abundant in fermented foods. While vitamin K is crucial for blood clotting, too much can interfere with blood-thinning medications like warfarin, increasing the risk of blood clots. Scientific research. Research from the University of Maryland Medical Center indicates that excessive vitamin K can interfere with the effectiveness of blood-thinning medications, increasing the risk of blood clots and cardiovascular issues. Excess vitamin K can also reduce the effects of anticoagulants, leading to potentially dangerous complications. Conclusion and solutions. If you're taking blood thinners, consult your doctor before supplementing vitamin K. For those not on blood thinners, natural sources of vitamin K, like kale, spinach, broccoli, and fermented foods, provide a safe and effective way to support bone health and blood clotting. 6. Vitamin C, the culprit behind muscle fatigue. Scientific evidence and solutions role and importance of vitamin C. Vitamin C is an important vitamin for overall health. It is a powerful antioxidant that helps protect cells from damage caused by free radicals, supports the immune system, and helps the body fight infections. Vitamin C also plays an essential role in the formation of collagen, a protein necessary to maintain the health of skin, bones, blood vessels, and muscles. However, While vitamin C offers many benefits, excessive supplementation can lead to side effects, particularly affecting muscles and mobility. Mechanism and side effects of vitamin C. Vitamin C is a water-soluble vitamin, meaning the body excretes any excess through urine. However, when taken in excess, the body may experience side effects such as diarrhea, stomach pain, and muscle fatigue. Although vitamin C can help boost the immune system and reduce inflammation, consuming too much can lead to muscle fatigue, reducing muscle strength and mobility. Scientific research has shown that, while vitamin C is vital for the body, oversupplementation can cause digestive issues such as diarrhea and bloating and lead to muscle fatigue. This fatigue can limit movement and reduce flexibility in daily activities. Scientific research, studies in the International Journal of Nutrition show that excessive vitamin C intake can cause digestive problems like diarrhea, nausea, and stomach cramps. Moreover, research from the National Institutes of Health shows that excess vitamin C can cause muscle pain and fatigue, reducing muscle strength and mobility. This fatigue can significantly impact quality of life and hinder participation in physical activities. Conclusion and solutions. To avoid the side effect of excessive vitamin C supplementation, you should prioritize obtaining vitamin C from natural food sources instead of supplements. Vitamin C-rich foods such as oranges, grapefruits, strawberries, bell peppers, and kiwis are excellent sources that provide the body with the right amount of vitamin without the health issues associated with excessive intake. Supplementing vitamin C through natural foods not only helps strengthen the immune system, but also maintains muscle health and reduces fatigue. Always remember, while vitamin C is important, using it in reasonable amounts and from natural food sources is the safest way to protect your overall health without any unwanted side effects. In conclusion, in this video, we explored 6 vitamins that may negatively affect muscle strength and mobility, especially in older adults. While vitamins are essential for health, excessive supplementation can cause serious side effects, from muscle weakness to the risk of falls and cardiovascular problems. To protect body health, prioritize natural food sources of vitamins, and always remember that balance is key. If you want to continue receiving valuable health information and ways to maintain flexibility in your later years, don't forget to hit subscribe and turn on the notification bell. Share this video to help more people protect their health. Thank you for watching and see you in the next video.